baby's nice and calm. So the first thing we're going to do is go into an on all fours position. So if you want to join us doing that as well. This is also what we call a functional movement to use with a baby, because often you'll find yourself in this position. So Alison, if you'd like to get yourself onto your hands and knees, it's really quite a good idea to change your baby on the floor like this, and it's important to make sure that you're holding your back in the right position. So Alison's doing that for me now. She's holding her back in that lovely neutral position, small little curve in her lower back, tail slightly lifted. I'm also going to ask Alison to draw her shoulder blades back and down, so I want you to do the same thing. And actually, if you've got your baby in this position, it's perfect because you're looking down at their eye level, and that's also bringing Alison's neck into the right position. So make sure you're not looking down between your arms or looking up as well. Obviously, you might be looking up at your TV screen right now, but try to put your head back down when you can. We're now going to just do a lovely stretch for the back. So all I'm going to ask you to do, and I'll let Alison to do it as well, is just to lift your belly and just stretch up like a cat. You can now drop your chin down towards your chest, lifting up through, pulling your tummy muscles back towards your spine. Hold that position and then release back again. It's really good to use breathing when you do this. So take a nice big deep breath in. As you exhale, lift up and stretch through the back. And we get a lot of tension in this area of the back, so it's quite a nice thing to do. Okay? And then release back again. And you can talk to your baby while you're doing this. Yeah? And then lift up and go into your cat stretch one more time. Okay, and release. Now we're going to go into our next exercise. I'm going to ask Alison to hold this position, and this is the cat kneading exercise that you may have seen before because you'll have done it in your antenatal exercise, but with a slight different emphasis now because your baby is in front of you rather than in your tummy. And what we're going to do now is again focus on the core muscles. So remember, pull up through that pelvic floor, lift your belly back towards your spine, keep the spine nice and long, hold that position. Now imagine you've got a glass of water balancing on your back, you don't want it to move, and you're going to nice and slowly lift one hand and then the other hand off the floor. Now as you're doing this, make sure that your back stays nice and still. Keep reminding yourself of your core muscles. I want you to try and do about 10 lifts on each side. If you get tired, just relax, release and sit back onto your heels. How are you doing, Alison? Are you okay?
Yeah, that's fine.
How's George doing?
Fine, aren't you? Yes.
Good. I think Grace is nearly about to fall asleep, so she's all right. Okay, keep drawing the shoulder blades back and down. Keep pulling your tummy muscles in. And another way to do this is just to bend your elbow just a little bit as you lift up, so just try a few more like that, that's it. And you don't have to lift your shoulders quite so high, so just relax the shoulders down and just bend the elbow, that's it, good. So all the while keeping the neck nice and long, thinking about looking down at the floor, drawing the shoulder blades back and down, and you can relax it there, it's good.